Allergy is a very common topic these days. In fact, what we see is that globally, 30 to 40% of the population has some kind of allergies. Latest stats in India show that about 20% of the population, at least in urban India, is afflicted with some level of allergic reaction. That's 2 out of 10 people. How does someone even know that they have an allergy? Like, I could be experiencing, let's say, sneezing or itchiness, watery eyes, and things like that.
If you woke up every morning sneezing for a couple of hours and it happens, let's say 5 times in a week, you're most likely to have allergies. Food allergy can be life-threatening. It can cause anything from wheezing to swelling of the lips and eyes, decrease in blood pressure.
Hi guys, I'm Dhruv Gupta, co-founder of Orange Health Labs, and welcome to the Orange Club podcast. Here we'll be bringing on doctors and health experts to talk about all things that help all of us live healthier and better. Hi, today we have Dr. Gurmeet Soni Bhalla with us. Dr. Gurmeet Bhalla is a seasoned allergist and a pediatrician with over 25 years of experience across Fortis, Rainbow, and RxDX. Besides her medical expertise, she is also a very inspiring runner. She's done marathons across all 7 continents from Machu Picchu to Antarctica. Very excited to have Dr. Gurmeet Bhalla here. Welcome, Doctor. So, hi, Doctor.
Hi.
Allergies is a very common topic these days, right? In fact, what we see is that globally, 30 to 40% of the population has some kind of allergies. And, from what we understand, latest stats in India show that about 20% of the population, at least in urban India, is afflicted with some level of allergic reactions, right? I mean, that's 2 out of 10 people. Growing up, this would have sounded bizarre, but now living in Bangalore, myself having experienced a lot of the allergy challenges that most people face in Bangalore, it doesn't seem like such a surprising number, right? What I wanted to start is maybe just talk a little bit about, what do you see? You've been an allergy practitioner for a long time. And what do you see in terms of the most common allergies? What's sort of the landscape of allergies that you see from your practice?
Very good question. So because I'm a pediatrician, I would start with babies as young as maybe a couple of months old with food allergies or the milk allergy. So it can start from gut, and then it could go to skin allergy like eczema growing up. And then the march goes to, it's called as an allergic march. And
Okay.
then as the child gets older, they may have runny noses, sneezing, which is called as an allergic rhinitis or hay fever in common terminology. And if you did not control your immune system, which is the reason you have allergies, because this is a reaction, exaggerated reaction to a normal allergen, which this particular person is overreacting to, then it can go into something which is called as asthma or the allergy of the lung. So I see the whole spectrum depending on at what stage a person, or whether it's a child or an adult, comes to me.
About among adults, what do you see is the most
So among
frequent?
adults, I see allergic rhinitis, the sneezing the most, and some asthma I see as well.
Okay, and what in your opinion is the fundamental cause of allergy? What causes allergies in our body?
So like I said, there is a agent called allergen. It could be air,
Okay.
it could be a food, it could even be an insect. All right. When you come in contact with this particular allergen, your body releases some chemicals which are histamine and cytokines and all of that. And there's a reaction, there's a fight inside your body. So when your immune system is over exaggerated, it fights harder. And because it fights harder, then you have all kind of reactions like sneezing, watery eyes, head congestions. Sometimes skins get hives like urticaria, which we call it, or even breathing difficulties. which is called as an asthma. So it is a exaggerated immune response to a benign allergen.
Got it. And, I've experienced this myself that you can actually develop allergies at any point in your life. They can come and I guess they can go too. What's why, what happens suddenly? Like 1 year, suddenly you'll start experiencing allergies. What causes something like this?
So it's probably because you probably are not aware of what you're allergic to. For example, if you're allergic to, let's say, grass pollen, and then you decided to play golf, and you going to the golf course where there are different kind of grasses, that time you will experience more allergic symptoms like sneezing or even hives, you would get it. But there are other times that you are not in that environment, or this is seasonal because grasses are seasonal and it's the pollen of the grass which causes it. So you may not experience it. So sometimes what you are exposed to, if you're exposed to more allergens, you would react. But I think where also question says that I may not be allergic for a while and then I start allergies. Why does that happen?
Hmm.
So multifactorial. It could be that where you're living has high allergens, and then you suddenly have started getting sensitized to that. That's one. Secondly, it could be a highly polluted area. Pollution is adding a lot to allergies, definitely. Thirdly, you must be having inflammatory conditions because of the state of your mind, because if it's your stress or your gut health is not good, or there has been too many antibiotics that you've taken, there's been a topsy-turvy health of your gut. So there could be multiple reasons why suddenly you get flare-ups.
Got it. Got it. That makes sense. That, even though it feels like we're static, we're really not. It's a very dynamic situation where, it could be stress. You said it could be gut health. It could be some medicines. It could be a new activity that you started, or, combined with your body developing sensitivities to it. Uh,
Absolutely.
you know, I mean, one thing that you talked about is this pollution, right? I mean, AQI is a metric that my kids also know now, right? And there's a lot of talk, especially in the last few months, about air quality, right?
Yeah, after Brian Johnson ran away.
Yes, that too. How does pollution lead to more allergies? What is that relationship like?
Oh, I think it's completely synergistic. The higher the pollution, the higher the allergies. Pollution is caused by multiple things. PM particle size is one, that particulate matter. That is one. Then there's sulfur dioxide and carbon dioxide from the vehicles. There could be general dust in the area. All these comprise uh, how a pollution in an area comes by. And there's a lot of construction that's going on, especially in newer cities. So there's a lot of dust particle. And with this dust particle, the pollens or the diesel fumes that get suspended in the atmosphere, the pollens get stuck onto that, and their we call it the immunogenicity, that their allergenic quality increases when you inhale with these particular particles,
Okay.
especially with diesel fumes. That's why you'll see urban areas will have more allergies because there's too much of vehicular traffic and smoke and fumes that we tend to inhale, and that increases the level of whether it is the regular grass and weed pollens or even the dust mites which live in our houses. Even they get clung onto these pollutants, and then you tend to inhale it. And these pollutants, whether it's nitrogen dioxide or sulfur dioxide, are essentially toxic. They are toxic to the body because they are toxic fumes. So both together just completely change the picture and make you more allergic.
Wow. Okay. Okay.
So pollution, I think we should all pay attention to pollution. I mean, it's great that we have avenues like having air purifiers at home, but I think at a geopolitical level, people should do something about air pollution. And I'm definitely I was in sync with when everyone was talking about that our AQ quality is so bad. It is the truth, and that's why lung diseases are increasing. That is one of the primary reasons lung diseases are on a high.
Wow. Okay. Yeah. So, we're talking about allergies right now. And you just said, for example, that pollution is leading to more lung disease and things like that, right? I mean, so what should people be doing to protect themselves from allergies? For example, I live uh, in a high rise. I live on a top floor. Does that potentially protect me from some pollution if I live on a lower floor? I mean, what are things that people could do in their general life to sort of help them help reduce their exposure to pollution, especially when you're at home or in an office in an indoor environment?
So, indoor environment, of course, you can control because you could, like I said, use air purifiers. I really think air purifiers with HEPA filters bring down the level of the dust and maybe the mites that are in that space. So, it helps to improve the quality of the air that you breathe in that room. And it's probably a good idea to have it in the bedroom. At least you'll have cleaner air for about 8 hours or so. If I were to suggest investing in something, that would be a vacuum cleaner because the amount of construction that goes on and the dust that comes in living in India, I don't think you can avoid it. So what it does is cut down on the dust that is there. So there would probably be less dust mites, and which is the commonest allergy in our country is house dust mites or even storage mites. That's the highest. Cleaning your surfaces. I normally suggest people to use a damp wipe to clean surfaces and not just like, you know, move the dust around with a dry cloth. Have less clutter in the areas that you live in. So have less books, especially in your bedroom. Try to avoid carpets in your bedroom so that there is so any fabric which is thick will accumulate a lot of dust and mites. So indoor air can be kept clean like that. Also make sure that you don't have very high humidity. There's a big thing about using humidifiers, but one has to understand that a humidifier should be used only if the humidity is below 50%. If it is
Interesting.
above 50%, you're going to have mold, and mold is a big allergy, and mold allergy is a very severe kind of allergy. So making sure that there's enough ventilation, where means air and sun both come into your living spaces. The toilets and the kitchens are well hydrated or well ventilated rather, so that the moisture escapes, so there's no mold in the areas that you live in. So these are few things that one can do to prevent indoor allergens. And another indoor allergen, of course, is our furry pets. So I love pets and I have 3 dogs. But the only thing that I would say, one vacuum cleaner definitely helps to remove a lot of their fur and maybe dead skin. The second thing is that no matter how much you love your pet, try to keep them away from your bedrooms as much as possible, because that's your space. And if you contaminate that space, if you have a cat or a dog dander allergy, then it can get aggravated. Simple way is not to sleep with your dog or your cat or your furry pet. It would decrease the chances. So these are some of the measures we could do. And interestingly, indoor air pollution is also caused by something called as VOC agents, which is called as volatile organic compounds. And you see them by burning candles, by burning incense sticks. Even your floor cleaners, which are harsh, emit some kind of fumes. So when you buy a floor cleaner, go with the organic ones so that they don't emit those fumes. They decrease the quality of air that is there in the room. Some plants you would have heard of are air purifiers. You could use sparingly. I don't believe in having too many plants because then we have an issue of the mold coming on the plants and it becomes a double whammy. But yeah, that's
Wow.
how you could
Okay.
probably improve the quality of the air that you breathe in indoors. Outdoors is very hard. The only suggestion I have is if it is a very highly polluted area or you're traveling in open vehicles or two-wheelers, is to wear masks because that would prevent some impurities from getting in your nose and mouth. Besides that, I think we can't do much about outdoor air until, of course, there are higher authorities who take it upon themselves to keep the AQI of the city in a healthy zone.
Yeah. Yeah, no, I mean pollution is one of them. We're in Bangalore. Bangalore seems like the pollen capital of the country, at least in the big cities. In fact, when I moved here a decade ago, I suffered a lot from allergies. And what makes Bangalore such a hotbed for pollen?
Yeah. You know, I've lived here for so long. I am now a big supporter of Bangalore not being allergic because there are a lot of other cities which have allergic issues also. Bangalore gets a bad name because it has the ambient temperature. So if it is ambient for human beings, it's ambient for viruses and fungi and house dust mites. So we have to share that space. It's big and it's true. House dust might live in between the temperature of 20 degrees to 35 degrees. Bangalore is the perfect place. Mold, if the humidity goes up, this is the perfect temperature. It doesn't grow in dry, hot areas, so this is the perfect place to have. Coming to Poland, Poland once was Bangalore's cause of allergies,
Mm,
but now it's not so much. Where are the trees? Half the trees have been chopped off. So what has really hit us is the construction, and because of that, a lot of dust in the air. The the pollens which are affecting us not from the trees and from flowering plants, as people might think that big beautiful flowering trees give you pollen and that cause allergy. You'd be surprised. The more attractive and the bigger the flowers, the lesser chances of the pollen giving away allergies, because these are essentially not, we call it a wind-borne pollens. Their pollens are not very light that they fly the far away. They are colorful because they want the insects and the birds to help them pollinate. So they are very sticky pollens. So these pollens don't get carried away very far. So I don't think pollen from these trees are the cause, but the pollens from the weeds which grow in dead spaces, roadside, which are like the Parthenium grasses, the ragweed, ricinus. Ricinus is a castor plant which is growing wild all over Bangalore, has made it so the allergenicity is very, very high. So when I do testing, I see a lot of these weeds which are causing allergies rather than beautiful blooms of Bangalore.
wow. Okay, that's an eye opener for me. I
Isn't it?
imagine it was
Yeah.
something
So
else.
I people say pollen allergy. I said there's no pollen in Bangalore anymore. We've chopped away all the trees with construction.
That's unfortunate.
It is,
Um,
yes.
yeah, so one is Poland, like you said. The other was stress. That how does stress lead to more allergies?
So with this, so stress causes a increase in a hormone called cortisol. Okay, and when the cortisol increases, then there are chemical reactions again which happen, and some of these chemical reactions cause our gut microbiome to get disrupted, and they start releasing something called as a histamine from mast cells, and then the production of the histamine increases. There's a particular protein called specific IgE which rises. So it's basically a cascade
Hmm.
that gets triggered when your stress levels are high, and that can lead to a reaction. An allergy is an immune reaction. So when your immune system is like on fire, something comes in contact with it, it just combusts. It's just that way.
Wow.
Yeah. So that's how stress causes it.
Got it. So we talked about gut health, we talked about stress, we talked about external allergens. How does you're into running and fitness in general? Uh, does your and now urban India, there's data to suggest that 3 out of 10 urban Indians, right, at least in the mid income and upper income segment, are are towards being obese or more, right? Uh, does weight or fitness have a role to play with allergy?
Yeah, certainly. So obesity is a byproduct of overabundance, essentially. I mean, there's a mismatch. There could be other reasons. There could be some hormonal reasons that one is obese, but essentially, input is more and output is less. And that's why one is obese. And that leads to something called as deposition of fat. Fat is like fire. Whenever you have enough increased adipose or fat in the body, your body is in automatically an inflammatory stage. So I see most people who are overweight will have metabolic issues, of course, which is not only diabetes and hypertension associated, because that particular fat is causing so much of an inflammation that's very difficult to manage. So that's why fitness or exercise or keeping your weight in check definitely helps you, even with allergies and, of course, other metabolic diseases as well, for sure.
Got it. And there are two kinds of fat, right? There's subcutaneous and there's visceral fat, the fat around your organs and the fat under your skin. Is there like one that is more active than the other from an allergy perspective?
So, I mean, when we talk about allergies, we really don't go deep down into that, the categorization of fat, because when you have visceral fat, which means you already having some kind of a metabolic issue. So when I see adults, especially when they come to me with skin allergies, the first thing I ask them is how's their blood sugars, and at least 4 out of 10 would have a high HbA1c. Okay, and that means they're in an inflammatory status which is high. So once we bring that down, their skin allergies or issues of the gut also settle down. So sugar and fat both are inflammatory,
Wow.
and that's what increases the allergies.
Okay.
So one has to look at it more holistically
Yeah.
than just, trying to solve one piece of the puzzle.
No, absolutely, absolutely. You know, I've even heard of people being allergic to things like sunlight. Uh, I actually have a friend. She's allergic to wine, and so she only drinks champagne as a result of that. But is do you see like this? Is this really true that there can be people who can be allergic to sunlight as well?
So, actually, allergy is an overused word. Okay, in medical terminology, allergy is like you came in contact with something and it caused an immediate reaction. Okay, action and a reaction. So, sun, of course, there is something called as a solar urticaria. That means if you went out in the sun, the UV rays can cause hives. So there's a truth in that. But there could also be that you get a little itching and one just says that, oh, I'm allergic to that. So we don't know, because these are self-reported, and then until and unless they're not diagnosed, we can't say. Regarding wine is supposed to cause more vasodilatation in the vessels, and you may have some hives or reactions. But again, I have come across people who say we have wine. Some can get hives, which is true urticaria, which is an allergic reaction, but you also get like a itchy feel or which is not considered as an allergy.
Got it.
But yes, these are true. Both the statements you said are true. You could have that.
Got it. Got it. I mean, these are more rare in that sense, you know. But like just switching to more common stuff, right? We grew up in an India where drinking milk was considered part of our everyday nutrition. If you didn't drink milk, it was there was a problem.
Yeah.
Uh,
Fundamental, right?
yes,
Foundational.
yeah.
Yeah.
Uh, Today we come across a lot of folks. I'm sure you do even more than everyone else, right? Who have allergy, right? Uh, what what's happened here is has India suddenly developed more allergy to milk, or is was it always there and we just didn't detect it? Or what's your thesis on this?
So there are multiple factors again. As developing nations, again, the environment is changing. So again, if you have more inflammation in you, you can get allergies. Like if there was, like we discussed earlier, if you had more stress or there were more environmental agents that kept you in a more inflamed condition, you may get allergies. So the lactose could be because of that. Sometimes there is something called as a lactose intolerance, which means that you just don't have the enzyme to digest milk. Okay, and you reach a point where you can't digest it. You were digesting it fine when you were growing up, and then the enzyme just finished. It's over. So you can't digest it anymore. The third thing is that awareness has increased. Because the awareness has increased, we are diagnosing it more. And so we find that there is more lactose intolerance or milk allergy in general. So yeah, there are multiple factors. And also the way we are getting milk now is also very different. Back in the day, there was raw milk that was consumed from the livestock that was either at home or it was in the vicinity. You would get raw milk and use it. We all use pasteurized milk now for various reasons, because the diseases have like tuberculosis are on the rise even in animals. So we want to keep it pasteurized and keep the viruses low. So it has changed the quality, and again, the allergenicity in the milk has increased because of these changes. Okay, pasteurization, environmental, and your own way your gut behaves towards milk, and we are more aware now. And it's also trending. People are staying away from lactose and gluten because a somebody says they feel better, b they say that it's inflammatory. But yeah, all of that could be true, but we just go off it because it's considered trendy.
Yeah, I mean, actually, you touched upon the next one, right? Gluten. I mean, wheat is such an essential, has been such an essential part of, like, let's say, diet, mostly North India, rotis, parathas. This was like, that this was basic sustenance, right? And
Absolutely.
now we're seeing lot more gluten allergy. Is this similar factors, like you said,
Yeah. With gluten also, similar factors. But with gluten, what has also happened is with to feed so many mouths, the quality of gluten grain has changed because it's getting genetically modified. It has to be resistant so that it is pest uh, proofed. So because of that, the quality of gluten is very different from what it was in 1900s than it is now. So that's also become kind of allergenic. And we are also using a whole bunch of refined flour now, which is adding to our troubles, because we're not really using the bran and the fiber part. Most of the processed food has flour which is completely refined, and that again increases the allergenicity of that particular thing. And then of course environment and stress and whole bunch of other things can lead to gluten. So there is gluten intolerance, of course, there's gluten sensitivity, and then there is the celiac disease. But by far gluten is considered to be inflammatory, like milk is considered to be inflammatory. The good part is we do have testing for most of that,
okay.
and because people are getting it tested, they know more about it.
So
But my 90-year-old father-in-law still eats rotis, and touchwood's doing very well.
yeah, yeah. I mean, it's hard to change some of these behaviors that we've grown
Yes,
up with.
but if somebody's thriving on it, then one doesn't have to follow the trend.
Yeah. Actually, to that point, right? You said, how does someone even know that they have an allergy? Like, I could be experiencing, let's say, sneezing or itchiness or any of, or like, watery eyes and things like that, right? How do I know that it's an allergy and not
A
an
common cold.
infection?
Yeah. So with allergies, it's consistently over a period of time. For example, if you woke up every morning sneezing for a couple of hours and it happens, let's say 5 times in a week, you're most likely to have allergies than an infection. An infection will be associated with other things like fever and weakness, and would only last for a very short while, 5 days, 7 days. Any bacterial viral infection would go away in that period of time. But allergies will persist over months, and it can go on for years if you did not take heed. So that's how you can find out. Similarly, with itching, itching could be something deeper. It could be a manifestation that again, your skin is liberating some kind of chemical which is irritating, and you need to fix it. So you start to look at again back to the gut again. If something is not working for you, or you constipated, or you're probably using products which are not working for you. Luckily, to diagnose allergies, it's very simple. Of course, we have to take the clinical history and not imagine that you have an allergy, but go to go to a clinician, get a check done. So the history is very important. The second thing is, it's a very simple test that we do in the clinic, which is called as skin prick test. All we do is put allergens on your hands, scratch them, your skin, and then it'll pop up if you're sensitized to a particular allergens, whether it is air allergen or food allergen. That is the gold standard. The other blood test that also is a gold standard in case you don't want to get a skin prick test is called as a specific IgE for a particular allergen, which is done in most laboratories. Simple way of getting allergies tested if you have one.
Got it. Got it. And what if I just ignore my allergy? Like, is there a downside to just not doing anything about my allergy?
Um,
Like, how
no,
dangerous is it?
as long as you are young and in the pink of your health, you might just be able to beat it for a while. It would bother you for a couple of hours in a day, and then you will be okay. But as one gets older and the aging again increases, inflammaging, we call it, your immune system tends to go again in a hyperdrive. So you could probably have severe ones, and then you will have headaches, not brain fog, not able to perform in either school or in office. It affects the quality of your life. And if you still thought that, oh no, I'll pop an antihistamine whenever it's working and then go on, it can lead to a nasal allergy, can go become an asthma, and then you will have wheezing. So if you ignore them, that's the march of an allergy. Yeah.
Got it. Got it. So we talked about testing, talked about how we shouldn't potentially ignore our allergies. What is the treatment like? I thought it was maybe taking an antihistamine, but is there
You're
more to it?
right. You're right. Firstly, I would say the treatment of allergy is prevention. If you get yourself diagnosed to a particular allergen, the best way to treat is prevent yourself from getting in touch. For example, if there are pollens, you can't do much about it. So you have to take some measures, wear masks while going out. When you go for a walk, come in, change your clothes, wash your face. That's all for pollen. And then we discussed about how we can take care of the house dust mites and things like that inside. But antihistamines definitely help in bringing the level of histamine down. It's the histamine which causes the reaction and histamine-like agents. So when we use antihistamines, it brings it down. But that is calming your system down. The prevention work you will have to do. You will have to make sure where you live, how you live, has less of that allergen. So that's why testing becomes more and more crucial, because prevention is the only way. The third thing is you can teach your immune system to not react. How do we do that?
Okay.
There's something called as a immunotherapy. For example, you got yourself tested and you came positive to house dust mite. Your allergist or your physician who's diagnosed you will give you a small dose of allergen that you can use every single day in incremental doses so that you stop reacting to that allergen.
Wow.
Like for house dust mite, they will give you either drops, they're allergy shots too, that but you have to take it over a period of time, and you can get desensitized to that allergen, and that's called as an immunotherapy.
Got it. Got it. So that's what you also call as an allergy shot, basically.
That's correct.
Got it. Got it. And there's something called H1, H2 blockers. What are those? And
So H2 blockers are same thing. One is antihistamines, and H1 blocker are the antacids. So and the gut has both these receptors, and when we give these blockers, we are giving antihistamines, and sometimes because there's inflammation in the gut, and you can have an acid reflux, or if you have food allergies, you can have an acid reflux, and one can give the antacids also for or the H2 blockers for that.
got it. Got it. And so allergies can go away. It's not a lifelong thing. Is that correct?
Allergies can be prevented. It's not, you don't have to live with them. You just have to be proactive. If you're proactive, you would beat your allergies.
And this is true for like external allergen, not external, like it could be air allergens, it could be food allergens, um, you know,
So air, we can handle by doing a few things. Food is a different ball game altogether,
okay.
because sometimes we don't know what food you are allergic to. Some kids are born to have allergies to either milk or egg, nuts, eggs, soya. But as they grow older, most kids can outgrow their milk and soy and egg allergies. But the nuts, which is the tree nuts and the regular nuts and shellfish allergies, are hard to outgrow. So with the food allergies, we would definitely have to do either specific IgE, but the gold standard for testing for food allergies would be challenging with the same food that you think you're allergic to. So you give a little bit, if you have a reaction, then it means you have a food allergy. If you have a food allergy, then you'll have to abstain from that food. There is no way that we could give that particular food and say, it's going to go away, because food allergy can be life-threatening. It can cause anything from wheezing to swelling of the lips and eyes, decrease in blood pressure, which we call as anaphylaxis. And you would have heard of the fact that people use, they have epinephrine or injections with them so that they don't have it somewhere outside, and it could be life threatening. It can really exhibit itself in its full glory within 5 minutes to 15 minutes. So time is very, very of the essence if you know that you have a, a real food allergy to something.
Got it. Got it. I spent a few years in the US, and peanut allergy is a big thing there.
It
But it's
is.
not so much in India. At least I haven't heard of it. What's the reason for this differential sort of allergy reaction?
So this is a study which has been going on for a while now, that why the second generation Indians which are born in the West, the kids who are born in the West seem to have more nut and peanut allergy than the kids who are born here. And there's some theories that have come out. One is hygiene hypothesis, is which is that they live in much more sterile environment, and they don't come in contact with a lot of maybe grime, dust, farm animals, or in general things that can help in building their immunity. So they seem to have more allergies, especially the food and peanut allergies. That is one. The second thing that has come to our notice is that we in India probably use peanut in our food a little early in our weaning period, and probably that sensitizes their gut in a good way, and they don't react compared to when they live in the West. So there's still hypothesis. We've not been able to figure out why exactly they have more and we have less. India in general has less nut allergy.
Hmm. Yeah, some time ago I read about this behavior in Israel where they actually feed their kids like a peanut snack, and as a result, that early exposure leads them to also have lower peanut allergies, even though there's a large, say, Jewish population in the U.S. Right? One could be this hygiene
Yeah.
hypothesis. The other is also some kind of early exposure.
So what we are actually teaching parents or the pregnant women is to take peanuts if there is a history of peanut allergy in the family, so that we probably can prevent that in the offspring, and do weaning with these foods early, whether it's eggs or nuts or even wheat. So early introduction of allergenic foods can prevent a child from having food allergies in future.
Wow. Okay. Insightful. Switching gears, talking about we talked all about allergies, a lot of focus on adult allergies and behaviors and lifestyle, but we see a lot of children also today, suffering from allergies, and there's some data to show that children growing up in large cities are more allergic than those growing up in smaller towns and villages potentially. Um, so is could be pollution, some of these factors, but there's something interesting that we also came across, saying that actually breastfeeding is actually helps you have lower allergic reactions. uh,
Yeah, yeah. You've heard it right. Um, Breast milk is like a magic potion, okay, for a child, because it is full with so many antibodies and so many protective factors that's why there is so much of onus on breastfeeding in a newborn, because literally breast milk can protect against viruses, fungi, malarias, any inflammatory thing, because the mother's the breast milk is giving them so much of immune modulating cells that the child is able to get. So breast milk definitely prevents a child from having allergies. But before breast milk, even the type of deliveries, vaginal delivery gives more protection than cesarean sections. Children who have cesarean sections seem to have more allergies than the ones which have had normal deliveries. So yeah, both these are nature's gifts, and they really go a long way in protecting a child.
wow. Okay, hope you guys enjoyed the podcast. If you like it, comment, subscribe, tell your friends about it, and if there are any topics that you want us to cover, just add it in the comments and we'll make sure we'll cover them in the future.